So take two for safety. So we have a good number of people that are trained in first aid. One thing we've talked recently about is we want to have a refresher on what is our responsibility in the event of maybe another contractor goes down, or a visitor goes down, or maybe somebody else in the public goes down. So let's talk about that for a minute. So each one of our trucks are provided a first aid kit, just like this, and then we have a first aid guide. So this is the reference that I always use. So those should be, one of these should be in your truck. If you don't have this in your piece of equipment or your truck, please reach out to safety. If someone goes down, give you an example. We're doing a trench and we have another subcontractor on the second house or maybe another part of the job. They go down and people start screaming, "Man down." So first of all, we want you to do, just like we did with training, is you want to do a scene size up. You want to make sure that that scene is safe for you to go into. Give you an example, if that person's been electrocuted, you do not want to touch that employee. Next thing you want to do is get your first aid kit and a pair of gloves. You want to wear those gloves. Next thing you want to do is identify how many patients you have. That one person may go down, but you found maybe another person goes down. The next thing you want to do is you want to call 911. You don't want to do this by yourself. Call 911, give them how many patients you have, what type of scenario you have, and then give them exact location to your location you're at. The next thing you want to do is you want to come up on that employee or that visitor or that public member, and you want to see what their name is, if they can talk to you. You also want to know what day it is. You also want to ask them what happened. So you want to get some little story there. Now here's my, according to American Heart, we want to treat for life, basically threatening things first. So when we train American Heart, you want to check for any bleeding. So if there's severe bleeding, we want to stop that, including putting on a tourniquet. Number two, check for airway. We want to check for breathing, and then overall circulation of all the extremities. So we want to do that. And then you want to do is, after you do that, you contact your first aid kit and any other things you want to address. But again, only do what you're trained to do. And then reach out when 911 gets there. You want to give them a sample. So basically a sample of signs and symptoms, allergies, medical condition, past medical history, then your last oral intake, and then the events happening. If you have any questions about first aid or you want to take a class from first aid, please reach out to safety. Be well.